Forward wants to rebuild the entire healthcare system from the ground up. I mean that. That's literal. That's not rhetoric. It's like, you name it, we want to do it. From open heart surgery to delivering babies to oncology to pharma, we want to rebuild it all. Now here's the catch. It's probably going to take us a few decades at minimum.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Adrian Aoun, founder and CEO of Forward, a technology-driven healthcare system. In this episode, we talk about reimagining healthcare from the ground up by vertically integrating every aspect of the experience. Adrian also shares his vision to create a more personalized, preventative, and affordable healthcare system. Let's get into it. Hi, Adrian. Welcome to Fitt Insider. Thanks for joining us.
Pleasure to be here. Thanks so much for having me.
Looking forward to today's conversation. And just to kick things off, maybe if folks aren't familiar, can you introduce yourself and tell us about Forward?
Absolutely. I'm Adrian Aoun, founder and CEO of Forward. We're a national healthcare system here in the United States. And what we're trying to do is we're trying to rethink healthcare from the ground up. We said, if you look at the existing healthcare system, you and I know, and basically everybody knows, that it's pretty broken. So we started looking at that and said, wait a minute, why is it broken? And one of the quick things that you realize is it wasn't really built for you and it wasn't really built for me, right? It was built for the insurance companies. It was built to get them rich as opposed to keeping us healthy. So we started to reimagine and said, wait a minute, what would it look like if it was actually built for us? So we started a healthcare system for you and a healthcare system for me, one that's actually meant to keep us healthy as opposed to, just getting them rich. And so we start with things like preventing illness as opposed to, waiting for you to get sick and trying to fix things when it's too late. So we've got locations all throughout the United States. We use a whole bunch of technology that we've built to kind of monitor your health and prevent things from cancer to heart attacks and kind of keep you going your best throughout your everyday. We have locations everywhere, and we also kind of pair it with, all the modern things like genetics, sensors, wearables, and all that to kind of keep you at your best all day long.
Yeah, super compelling concept. Obviously, reimagining healthcare. I think a lot of folks, to your point, they think of it's sick care. It's after the fact that we're already not doing so great. We have to go in and see a doctor. And a lot of times it can be kind of too late. When you think about, I would think a lot of companies say to themselves, like, we're reimagining healthcare. We're creating a new healthcare system. We're fixing sick care. Maybe what are you doing or how are you approaching that is not the same as folks that might say kind of the same thing?
Yeah. So look, at the end of the day, if you go look at basically every single healthcare system out there, every single company that wants to, say, quote unquote, fix healthcare, they all kind of roughly do the same thing, right? And like the reality is, you and I, we've all had the same experience. So I'll give you an example. So for me, I was a One Medical member for a bunch of years, right? And in fact, in my family, basically almost every male in my family had a heart attack. So what did I do? Well, I went into One Medical and I was like, okay, guys, what should I do? And they looked at me, they kind of like gave me my little physical in all of 6 minutes, right? And they looked at me and like, you're healthy. And I was like, wait a minute, we've kind of all been there, right? I looked at them and I'm like, well, hold on. My dad's had a heart attack. My brother's had a heart attack. My uncle's had a heart attack. What do you mean I'm healthy, right? And I'm thinking for a minute, it's like, well, what's my probability of death? I'm like, 100%. Like, I'm going to die at some point. And in fact, we kind of know what I'm going to die from. We know I'm going to die of a heart attack. What the hell is this person telling me I'm healthy? And like, you get it, right? Like, what they're really saying is, I kind of don't want to deal with your shit right now because it's going to cost me money. But you ever notice how you just like everybody else, you ever notice how your employer walks up to you every year and they're like, hey, it's time to get your flu shot. It's time to get your flu shot. It's time to get your flu shot. Well, let me just ask you, how many people do you know that are dying of the flu? Like, not a single one, right? So why the hell is everybody so focused on the damn flu, but they're not focused on the things that we know are killing us? Like, you and I know tons of people who are dying of heart disease, cancer, but nobody's walking up to us saying like, wait a minute, let's talk, Joe, about the cholesterol, the blood pressure. Let's talk about the cancer that you might be getting. In fact, do you ever think of how fucked up it is that like the first time you get a cancer doctor is after you get cancer? Like, what the hell? Do you want me to get brakes on my car after I get into an accident? Like, this is insane, right? So I'm standing there at One Medical. This dude's telling me like, oh, you're healthy, you're fine. And all I'm thinking is, no, you just don't care. And so I leave and I'm kind of like, I'm feeling a little helpless, right? And like any standard, like nerd at home, I've got my DNA sequence, I've got all my wearables, I've got all this data. And I'm like, I kind of don't know what to do with all this. So I go walk around, I go to a bunch of doctors, and I go to the best of the best, right? I'm a very fortunate person. So I go to a bunch of these doctors and I start handing them a bunch of this data. And these doctors kind of look at me and they're like, hey, dude, like, this is awesome, but I'm not equipped. I don't know what to do with all this. And I'm like, okay, now we've got a problem, right? You've got awesome doctors that are like, I want to help you. This is why I got into the ballgame. Like, I literally like went to school for 18 million years and I've been trying my whole life to help you. And I've got this healthcare system built around these, like, frankly, asshole insurers who literally have zero interest, who like pretend to help us with our damn flu shots, but really all they want to do is like wait for you to get sick. And I'm like, okay, now we've got the problem that we got to solve. Now we've identified this, right? So what we did is we said, okay, let's create a healthcare system that literally just says, okay, let's just use all the data the way it was meant to be used. So Forward's really simple, right? You come into Forward, and the first thing we do is we literally just say, wait a minute, your body is giving us an enormous amount of clues. But you ever think about the fact that your heart is beating like literally millions of times per day? Okay, well, nobody's listening to that. How insane is it that like you buy a car, first thing you do is you buy a car alarm. You buy a house, first thing you do is you put ADT into your house, right? Your phone has tracking. Everything has tracking today. And your body, literally the most important thing, nobody's monitoring it. It's like how did we wake up in the year 2022 and nobody is paying attention to the one thing that is literally life or death? So Forward started really simple and said, let's pay attention to what your body is telling us. So you come into Forward, and the first thing that we do is we start to get what we call a baseline of understanding of your health. And this starts with simple things. First, we do things like a body scan, where we've built this pretty awesome, it's a very sexy device. It's a cool body scanner. It takes everything from readings about what your lungs and your heart are doing to thermal scans of your body. But then we take blood readings, we take urine readings, we even sequence your DNA. We're trying to get a pretty complete picture of what is going on with you. We take all this information, you go into the exam room with your doctor, and now this is pretty cool because we've got this awesome screen on the wall that we've developed. It's got a model of your body, and all the information we've learned has been overlaid on top. But it's a smart screen. So as you and your doctor are talking about things, it starts pulling up all the relevant information that we've learned about you. In fact, anything your doctor wants to use in the exam room, they take a stethoscope to you, boom, it starts showing the live readings. You can literally see your heart beating on the screen right in front of you. Your doctor wants to start understanding your cancer risk. They're not like staring at your moles like we're in the 1800s. No way. They take the Forward dermatoscope that literally is a high resolution 3D camera that kind of scans your skin to map out all your moles and lesions. Again, the idea is really simple. We want to get as much information as possible to understand what is going on with you. We want to unearth the clues so that you are empowered to make decisions about your health. And so once we get that kind of baseline, we can start to help guide you along the path of what are the best ways to kind of prevent illness that might come your way or to treat illness that has already come your way. And then what's pretty cool is, because we know that your health isn't something that happens, once or twice a year in the doctor's office. Then what we do is we send you along your way with these treatment plans that are kind of custom tailored for you. And we send you home with sensors that kind of are relevant to kind of allow us to keep monitoring, keep an eye on the things that matter for you. And what's cool is your care team consists of your doctor and a whole bunch we have a worldwide team now of hundreds of medical professionals that are monitoring your health in real time. So they're just kind of keeping an eye on things for you. It's the same way that like ADT is like keeping an eye on your house and making sure your house is nice and safe. Well, now you know that people are always right there for you, making sure that your health is nice and safe at all times. And they're right there just a click away from your phone 24/7. And so you start to realize, like, wait a minute, this is the way like healthcare should be, not the way that, healthcare was built by, these crazy people that like in many ways just don't give a shit about you. And so this is what we set out to do a few years ago. We're still very early. We're only a few years in, but we're already live in, 20, 25 cities around the country. And it's taken off already. And so it's been a pretty exciting journey,
I think a lot of people listening to you, much like myself, are nodding their head and they're saying, yeah, exactly. Like, this is the thing that we wish we had. Obviously, we wish there was some level of not only empathy, but tech and monitoring that was going into this, prevention that was going into this, kind of continuous insight into all of the various things that are happening with our bodies, such that, we just don't get kind of laid up and or find ourselves in the hospital. But to your point, it's like the health insurance companies have to make money. So when you think about how forward, I think a lot of companies come into the digital health space and say, we're going to do it differently. And then over time, they find themselves like slowly getting beaten down by, how do we pay for this? How do we charge people? How do we make money? So I know obviously there's the membership model, $149 a month, but like, how is that even able to get you to a place where you're sustainable, making money and able to continue to grow this thing?
Totally. So one of the hardest things in the world of healthcare is that at some point you have to take this incredibly disciplined view of like, at some point, and I don't know what I'm allowed to say on your podcast, but if you'll allow me to be a little blunt, at some point you have to say like, fuck it, why the hell am I in this game? And most people, if we're going to be honest, most people start companies for the wrong reasons. Most people start companies because like, you know what? I'm going to start a company because I want to get rich. I'm going to start a company because I want to get famous. I'm going to start a company because I want to IPO. Well, and you know what? When you do that, the first thing you do is, oh God, look at all this insurance money. Oh God, I can work with the healthcare system. I can just get off the ground super fast, get off the ground super easy. And you know what? When you do that, you're going to be a part of the problem. You're going to start taking the insurance money. And you're going to start fueling the exact same fire that we have today, which is like literally the bane of our existence. And literally, I mean, it's stealing 20% of the money in this country. Healthcare is 20% of GDP, and it literally does almost nothing for this country, right? They take 20% of every person's dollar. It's like the biggest sham in this country. And that's what most people end up as part of. And I think it's got to stop. Okay. So forward, we have a luxury, which is candidly, we did not start this company because we're trying to get rich. We did not start this company because we want to get famous. This is our life's work. We are here because we want to help as many people as possible, right? Our goal is to get healthcare out to not even just the United States. Our goal is to get healthcare out to the planet. We want to get healthcare to the middle of India and the middle of Rwanda. And I know that sounds all preachy, et cetera, but I'm telling you genuinely, that is why we are here. And so when you think about that, one of the first things you do is you wake up and you say, yeah, it turns out like no matter what, we're just not going to play that game. That is just not why we're here. Now, it turns out that it's a total fucking nightmare, right? Yes, it's a hell of a lot harder because we have to go up to our members and we have to charge them when we could just very easily go sign their employers and sign, these insurance companies. But here's the deal. At some point, you guys got to ask yourself, what do you want to do? Do you want to build Tesla or do you want to build Ford? And at the end of the day, I am not here to build Ford. I'm here to build Tesla, right? I am not here to build a crappy existing system. I am here to say, like, either let's do it right or let's not bother. Because the existing system, like nobody with half a brain actually believes that the existing system is going to work. But you're totally right. We're on a long path. So most startups say, let's go ahead, let's spend 2-3 years on this thing and then we'll be happy and then we'll have made it. No, I think we'll be working on this thing for decades to come. And yes, it's a complete nightmare. Now, there's some parts where you say, yeah, it's a complete nightmare, but you know what? Maybe it's a little easier. You go, what do you mean it's easier, Adrian? Well, you know what? At some point, what you realize is I don't have to deal with billing codes. I don't have to deal with wrong incentives. You know what's pretty great about my job? We get to do what's right for the customer. I don't have hundreds of engineers sitting there figuring out new ways to scam my customers and bill them. I have hundreds of engineers sitting there literally figuring out new ways to save lives. Like, how awesome is that? You want to see how happy my teams are in comparison to their teams? Like any day of the week, people are a hell of a lot happier. We skip to work and they don't. I assure you on that, right? And so at the end of the day, I can go home and sleep well, and I'm not sure they can. And that's something I'll take to the grave any day of the week. So yes, it's a hell of a lot harder, but man, is it way more rewarding, Yeah,
not that I think it matters to you, but just I would be curious. Or maybe it's on the flip side, what type of feedback or rumblings have you heard from the kind of traditional healthcare system? Or do they kind of say like, hey, we wish we could do this? Or are they kind of like resentful of you saying, this is a sham, they're wasting our money and it's, really not moving in the right direction?
Yeah, you know what? So you can't paint everybody with the same brush. So the first thing I'll tell you is, So we hire a lot of doctors, nurses, medical assistants around here, and I will tell you, I've probably met with a few thousand doctors at this point. We do a lot of recruiting around here, as you can imagine. I think we employ, I don't know, 100, 150 doctors at this point or something like that. And the thing I will tell you, I have not met a doctor, period, full stop, who says, wow, the healthcare system's awesome. In fact, every single one of them is like, I got into this to help people. And if the healthcare system would get the fuck out of my way, maybe I would actually enjoy my job. Every single one of them hates the healthcare system, like period, full stop. Like you basically can't generalize in this world except in this circumstance where like literally every single one of them is like, all they're doing is standing in between me and doing the right thing for people. Like think of how awful that is, right? Imagine you were an engineer, right? You just graduated from, I don't know, Stanford. You go to work, you're excited. You're like, I'm going to go build things. And you show up at Ford, and the first thing I do is I give you a laptop from the 90s. You're like, what are you talking about? Like, I'm trying to build. What are you going to do? You're going to quit. You're going to be like, I can go somewhere else and I can get a laptop from the year 2022. You just gave me a laptop from the 90s. Like you literally just like took my hands and handcuffed them behind my back. You made me literally incompetent. That's what it's like to be a doctor, right? It's like you're a racehorse. You got all this training. You're really smart. You're really well-meaning. And the insurance companies just came up to you and were like, yeah, you know what? Fuck you. I'm going to do everything I can to make sure that you cannot be a good human. And you're like, and yet you're such a good human that you still show up to work for the rest of your life. Like that's how awesome doctors are, right? And so part of what we try to do at Ford is really simple. We literally just try to build them good tools. Like, please, like, we just want to get your backs in a way that they have not gotten your backs. And man, is it a tall order, because for decades, nobody's built them good tools. So they get really excited when we like, I don't know, when we build like the most simple things. Imagine like giving you a pen and pad of paper and you got excited. You'd be like, what are you talking about? And they're like, well, hold on. In the old world, I got kicked every day when I came to work. And in the new world, they don't kick me. And so it's like Stockholm syndrome, you know what I mean? And so look, there's great people in the healthcare system. There's also terrible people in the healthcare system. You know, I've met with an enormous amount of these execs, and I'll tell you, like some of them are like, they sit there and like, oh yes, the system is terrible. Yes, we should change it. I'm like, yes, as you make $200 million, like, you know, screw you. Like, that's not cool, right? Like, you don't get to complain about it and get rich off it. I don't think that's chill. But look, at the end of the day, I don't sit here super focused on that so much as I sit here super focused on, like, again, the people who need help. Like the kid in middle America who's got nothing isn't sitting here going, well, let's talk about the insurer and this. He's just like, just give me the fucking help I need. Give me the product that I need. The kid who's sitting in the middle of Rwanda does not care at all about ACOs and Medicare and universal this and universal that. He's just like, I need help. And so at the end of the day, we try to ignore all that noise and just build people the products, build people the things that they need. And if you keep your eye on the customer and kind of ignore the fray of the industry, then hopefully you'll do the right thing.
Yeah, you mentioned being early kind of in the process and doing this for a number of decades. And so kind of building the technology, you have this screen that the doctor uses to sit down with the patient or member. You have folks come in and they're getting their gene sequencing and getting the biometrics and the wearables that go along with that. Obviously, I'm assuming the doctor's spending way more time, right, with that member than they would at a typical doctor's office. What types of outcomes, impact have you started to see at this point, to say not only is this like anecdotally the way we should be doing things, but no, actually this is what's happening as a result of us doing it this way?
Yeah. So I love talking outcomes. You know why I love talking outcomes? I love talking outcomes because, like, in the world of, like, let's look at every part of the world. If you go up to the automotive industry and you're like, talk outcomes, everybody, Ford's like, okay, our car goes 0 to 60 in 3.3. Porsche's like 0 to 60 in 2.9. You've got actual numbers. And then you go talk outcomes in the world of healthcare and everybody gets really wishy-washy. And they're like, well, our outcomes are, and it's like, wait a minute, can you even give me a number? And no, they really can't give you a number. And so you realize, like, it's all part of their master sham, as I call it. Now think about why. Well, you got a couple problems here. So the first problem is, if you walk up to, you walk up to Kaiser and you say, what are your outcomes? The first thing you'll see is that Well, they only give you numbers for the people that walked in the door. And it's like, well, yeah, but you have like the world's worst product. So people only go to Kaiser when they're like basically on their deathbed. Nobody like wakes up in the morning excited to go to Kaiser. And so like at Forward, we actually try to get you to come into Forward before you have a problem, right? Whereas Kaiser is like, well, okay, you come into our ER when you're already on your deathbed. So the first problem is they literally don't have numbers for like the mass population that literally didn't show up. The second issue is if you look at it, they don't track people over time. They don't like actually know what happens. So you go to the doctor, they say, okay, you have this thing, take this medication, you go home. They don't know if you got better. They don't know if you got worse. What they do know is, did you come back in and bill them? So they've got billing. Remember, the whole healthcare system is built around billing codes. So, their EMRs, the electronic medical records, those are not records, just to be super clear, those are not records of your health. Those are like QuickBooks for doctors, okay? So let's be really, really clear. They've got invoicing systems, the world's fanciest invoicing systems. They do not have outcomes of health. So if you go look, the kind of common thing that, for example, Kaiser uses is what's called HEDIS scores. And HEDIS scores are awesome because you would think, outcomes. Okay, how often do people die? That's what I want to know. Like, what could be more important? How often do people die? That's not what a HEDIS score is. HEDIS score, I'll give you an example of a HEDIS score. How often did you tell somebody to get a mammogram? I'm like, but that's not how often they died. That's how often you billed them for doing a task, right? And it's like, again, you look at how screwed up this is. So in some ways, I can tell you what Forward's outcomes are, but I don't know how to compare it to anybody else because they don't even have their outcome data. So let me give you some examples. So we work on programs to actually try and save lives. So one of the things, and we're very early, but one of the things that we've been focused on, obviously, is heart health. Just turns out that people actually do die of heart issues in the United States. It's as much as we talk about COVID, it turns out that heart issues are like way higher than COVID lately. And so one of the things that we wanted to focus on was lowering people's blood pressure, right? Like what could be more important? Like this is really, really, really up there, right? And so this is pretty awesome. So we have a heart health program. If you enroll in our heart health program, you're basically 4x as likely to lower your blood pressure than if you don't. And I was like, this is awesome, right? 4x is likely to get to non-hypertensive as not. And I'm sure at some point we'll go like actually publish real reports on that. But that was awesome. Like this, and these are the sorts of things where it's like, if we could get everybody to start publishing like the actual outcome measures of the things that matter, I would love to be in that world. And I hope that as Forward progresses over time, that we can start setting industry standards and benchmarks on this, not, hey, it turns out we convinced you to, do some procedure that got us an extra $240 from an insurance bill, because I'm pretty over that sort of nonsense.
Yeah, another piece of it that I was curious about is obviously there are certain aspects where as a member, I would still have to interface with the traditional healthcare system, right? So I'm paying this membership, and if I have to see a specialist, if I have to get surgery, if I do have something like cancer, at that point, am I on my own? Is there any type of way that you help me interface? So what is that relationship like?
So this is one of the super obnoxious things about technology disruption is it takes time. So let me give you kind of an analogy. So imagine I came up to you like 15 years ago and I'm like, I've got this thing and it's called the Tesla Model S and you should buy it. It's like super badass. It's this new thing. It's called an electric car. And you're like, okay, I guess you've sold me on this thing. Sure, I'll buy it. In fact, I'm going to buy it and I want it this weekend because I'm going to go up to Tahoe this weekend. I'm like, well, hold on. It doesn't actually have enough range to go up to Tahoe. I mean, it will one day, but not yet. And you're like, whatever, no big deal. I'll stop at a gas station. And you're like, well, hold on. It doesn't work with normal gas stations. It needs a special gas station called a supercharger. Fine. I'll stop at a supercharger. Well, hold on. We actually haven't built the superchargers yet. And you're like, at some point, you're like, what the fuck, dude? And it's like, okay, you know what? It turns out it's really goddamn annoying. So 15 years later, no big deal. The batteries got better. The superchargers are everywhere. Now it works. And this is kind of the entire notion of Tesla, which is it takes a few decades to rebuild the entire automotive industry. They're not the only ones. So I don't know if you remember this, when the first iPhone came out, you look pretty young, so maybe you were like still in diapers or something. But when the first iPhone came out, everybody complained. They were like, this is the walled garden. And you know why? Because like before the iPhone, it's like I had a GPS unit, I had a digital camera, I had a Sony Walkman. And everybody was like, Apple, will you just kind of go work with those? And Apple was like, no, because we believe in this thing called this app future. And everybody was like, yeah, but you don't even have an app store, dude. What are you talking about, right? And Apple was like, give us time. So people complained and complained. 15 years later, the whole world has been rebuilt as apps. Now we don't complain anymore, right? Well, here's the deal. Forward wants to rebuild the entire healthcare system from the ground up. I mean that. That's literal. That's not rhetoric. It's like, you name it, we want to do it. From open heart surgery to delivering babies to oncology to pharma, we want to rebuild it all. Now, here's the catch. It's probably going to take us a few decades at minimum. Okay, so we're a little senile, we're a little crazy around here. Maybe we're delusional, but we really want to try and do it. Okay, so here's the issue. The issue is that in the interim, it's a little like when you had your iPhone. Yeah, I've got my iPhone, but I've still got my Walkman. I've got my iPhone and I still got my digital camera. But every year it gets a little better. So when Forward started, it was like, wow, what was Forward? Well, honestly, it wasn't that much. We hadn't built that much. And then, 6 months later, we launched, genetic counseling and sequencing. Okay, that was cool. 6 months later, we launched our first forays into dermatology. Cool. 6 months later, we launched our first forays into cardiology. Cool. 6 months later, we launched our first forays into mental health. Cool. Then we launched a little into weight loss. Cool. Then we launched a little into prescription management. Cool. And then what you can see is we're slowly but surely taking on more and more and more of healthcare. And every day, it just requires you to leave our system just a little bit less, a little bit less, and a little bit less. Now, you're totally right. We don't do open heart surgery yet, but we will one day. And we don't deliver babies yet, but we will one day. And that's the whole ball game. The whole ball game is that one day we want to get there. And so the whole thesis of Forward is really, really simple. We will either get healthcare to billions and billions of people and rebuild this whole damn system, or we will leave an enormous crater of destruction in our path to do so. I don't know. It's going to be one or the other, man, but we're definitely working on it.
Yeah, super ambitious and really impressive as well. Just, I think in coming out and saying it from the onset, the kind of my mind then logically goes to, if you already at this point have continued to expand and offer all these different programs and the price has been $150, what does that look like as you get into open heart surgery, right? I think I read somewhere, maybe I listened or heard on a podcast, you said, if you could do it for $0, you would. So how is it that then you continue to build out this sustainable model with charging the same amount or less, if that's possible?
Yeah, in fact, our whole we will get cheaper and cheaper. So it's not if we could, it's when we will. Okay, so here's the deal. So the mistake that everybody makes today is we all think of healthcare as a service, but healthcare shouldn't be a service. Healthcare should be a product. And once you stop thinking of healthcare as a service and you start thinking of healthcare as a product, everything in your mind starts to change. So when you think of a service, you think of things and you go, oh my God, how are you going to deliver open heart surgery for pennies on the dollar? That sounds insane. But when you think of things as products, then you go, well, of course, Google delivers the entirety of the world's information to the whole fucking planet and charges $0. Of course, products scale incredibly cheaply. Now, let me just give you a really, really simple analogy, okay? Let's pretend you landed on this planet today. You're literally an alien from outer space, and you land on this planet. It's your first time on this planet. And I want to explain two concepts to you, okay? One concept is the iPhone, okay? It's a small little thing. It's about 4 or 5 inches big, fits in your hand. It literally has enough capacity to store all books ever written right here in the palm of your hand. It has this thing that can take it's literally a photographic memory. It has microchips and AI processors. It can connect you to all information on this planet in under about a second. Okay. It's built by tiny little robots in little factories, and it's called the iPhone. Okay. On the other hand, I described to you open heart surgery. Open heart surgery is a little like, when you're having a steak dinner and you got your little fork and knife. It's a little like that, except it's a really clean fork and it's a really clean knife. And instead of a white tablecloth, it's usually a blue tablecloth. And instead of you wearing your normal t-shirt, the person is usually wearing a white coat and they've got some plastic glasses on. And and that same face mask that you wore outside during COVID, they're wearing one of those. Okay. So one of these, I tell you, costs $100,000, and one of these costs $399. You're from outer space. What are you going to say? You're going to say, well, shit, the iPhone costs $100,000. And I say, no, actually, the iPhone costs $399. And you're like, what are you talking about? The other one just looks like it's the same thing as when I'm like eating my steak dinner. Why the hell did that cost $100,000? And so let's think this through. Why is open heart surgery $100,000? Like, what went into that? So was there some, I don't know, titanium or palladium or gold used in open heart surgery? No. Okay. Was there a $2 million machine used that like broke at the end of it? No. So what went, like, where did this money go? Was there like a bunch of consumable parts that we had to throw away? Well, I guess cotton swabs cost a couple bucks. I guess that tablecloth was like $2. I guess that really sterile knife was probably $3.99. So no. So where did this $100,000 go? And you quickly realize it went to two places. The first place that it went was, those insurance companies, go look at their profits. They made a lot of money last year. They got to make it somewhere. Okay. And the second place that it went was, it turns out that the person doing that work went to a lot of school. So let's be real. I went to Harvard, Stanford, and Yale. Okay, so that shit's got to stop, right? So let's stop this notion. Let's get out of a world where open heart surgery has to cost hundreds of thousands of dollars. If we can build an iPhone for $300, there is no world in which open heart surgery should be costing $100,000. Open heart surgery should come down into the tens of dollars to single digit dollars. There is no fundamental reason that it should not. And I think that can happen in this day and age.
And in Forward's vision of that, are you building those robots? Are you building those, whatever the supercharger equivalent is?
I certainly hope so. There's a lot of work to get there. I don't think we're going to be the only ones. I hope that we help catalyze that future. And I hope that we are certainly a big part of it. But yeah, I definitely hope so.
Awesome. Well, as we get towards the end of the conversation, thinking about then what this looks like as we go forward, not only with, what you hope to build in your vision of healthcare, do you envision a world where then as a consumer, I just have a subscription like this for every different aspect of my life, that down the healthcare path, or if it is, right now, when you think about going to the dentist, it's basically the same experience. When I think about health and fitness, it's the same experience. Will we be all choosing this path and kind of buying into this company and their vertically integrated model of healthcare or any other aspect of well-being or potentially life?
So I think it's really, really important that consumers are the ones paying for healthcare, because I think it's really, really important that the incentives are aligned, that you're the customer at the end of the day. Because if anybody else is the customer, they're building for them, they're not building for you. And we need you to be at the heart of healthcare, nobody else. But on the other side, healthcare needs to be really fucking inexpensive. Because at the end of the day, you know how everybody walks around and they say healthcare is a right? Kind of always annoys me when people say that. I'm like, sure, but who the hell's going to pay for this thing that's already 20% of GDP? It's like saying being a billionaire is a right. If you don't have a solution for it, like how's this helpful at all? I actually want healthcare to be a right. And the only way I know how to make it a right is for it to be so damn dirt cheap that literally everyone can have it. The same way we can say information is a right because of Google, right? Because it's been democratized. So I want healthcare to be democratized by making it a consumer product, but making it so dirt cheap that literally everyone can have it.
One more question before we wrap up. To this point, I think maybe like last funding round was $200 million in total, maybe, a little over a couple $100 million. At this point, you haven't even raised that much money. There are definitely kind of consumer products and SaaS enterprise companies and all different types of companies that are not trying to reinvent healthcare that have raised much more. How have you thought about financing? How will you continue to fund the company?
We've raised a lot more than $200 million, but I like how you just told the founder who raised $200 million, you haven't even raised that much. Makes you really feel good for your fundraise.
Well, just a quick, maybe caveat, like even if you look at a company now that gets a lot of hype, especially around like our audience, like Peloton raised $900 million before they went public.
Yeah, we've raised about $500 million so far, but yes. So look, when you look at companies like us, we are not a pure software play, right? We are building real physical infrastructure. These companies are expensive. They take real money to build. On the other hand, unlike the Pelotons of the world, unlike a bunch of these SaaS companies, these companies are also durable. Peloton might be popular today. Peloton might not be popular tomorrow, as you see, and you're seeing this with all sorts of companies, especially in the last few weeks. But you know what? You know what isn't changing anytime soon? Health. Yeah, for better or for worse, turns out death is not changing anytime soon. Turns out we all have a very hardcore need for health. And so when you work on problems that are at the core of humanity, it turns out that you take a very different trajectory. They don't have the Instagram growth curve. They don't go from 0 to 1 billion users in a year. But they also don't have the Instagram death curve, right? They don't go from, it turns out Snapchat was hot, now Snapchat's not. Like, no, these are real companies. These things last the test of time because it turns out that they're building fundamental services and fundamental needs that we all need. They're universal to humanity and they're the things that matter. The reality is at some point, I don't want to be on my deathbed talking about photo sharing. I want to be on my deathbed talking about saving lives. And we're very far from achieving our mission, and I don't want to get ahead of ourselves. We have a very far way to go. But if nothing else, I know we're giving it the good old college try. And so hopefully we make a dent in the problem.
Awesome. Well, I appreciate you taking a few minutes to share the vision and the process thus far with us. For folks who are interested in following along, want to keep up, I know I will certainly be keeping tabs on everything that Forward's working on. Where would you direct them?
You can check us out at goforward.com or on any of the socials. We're pretty much on all of them.
Fantastic. Thanks so much, Adrian.
Talk to you soon, guys.